sorry. So let's just jump to a big summary of what's really going on with COVID-19 cases globally. So we are up over 367,000 cases, up since Friday, 132,000 cases. And what's really important to note is Italy is continuing to rise very, very quickly. And the United States is now in third place, not that we want to be in third place, with number of cases behind China, Italy, and now the US. So Italy's up to 64,000 cases, and unfortunately that's 23,000 more cases since Friday. The US went from 10,700 cases on Friday. We're now at 41,000 cases. And again, part of that is really increased testing, but not all. And so it's a huge, we're up 31,000 cases since Friday. Now, if we look at US data, you've probably been seeing on the news that New York is being just killed. And the numbers are staggering in terms of how many cases there are in New York and New York City. So New York is at 21,000. In Manhattan itself, it's almost 16,000 of those. And that compares to Washington State, which has 1,600 cases, California, 1,500 cases, and now Ohio, we're at 442 cases. So you can see the magnitude of difference and why New York is just getting killed. Unfortunately, we're now up to 6 in the state of Ohio, which, that number is increasing with the increasing number of cases. So again, we are on the huge upswing, and I think this Governor DeWine's mandate now for stay at home is really, really important for the next 2 weeks. And again, we can talk ad nauseum about why that is needed, but I encourage everyone to stay at home, which is hard. And so I'm really thrilled to turn it over to Dr. Ashley Solomon, who's joining us today to talk about kind of this situation and how we all might cope a little bit better with this prolonged period of time where we're sheltering in place or all have to stay home. And thank you so much for joining us today, Ashley.
Thank you for having me. I noticed myself, I'm so grateful to you for keeping us apprised on all of this great information. And at the same time, I just noticed my heart racing as you're talking about these increasing numbers. And so I know a lot of people probably are having a similar experience with all of this information kind of coming in. And as things, we know are getting worse before they will get better. So I'm grateful to you for that information. And for those people out there watching who are feeling really anxious and overwhelmed, I appreciate Dr. Larkin having me on to talk a little bit about what we can do in this time of uncertainty. So thank you. So I wanted to share just a few things that I know a lot of us are experiencing as we navigate these uncharted times. I think the first thing that many of us are struggling with is all of a sudden our routines are completely shattered in many cases, unless maybe you are somebody who worked from home and already homeschooled your kids and had it all together. But I know for most of us, that's not the case. And so when everything that on top of a crisis and feeling the weight of that crisis, when we don't have our typical routines and coping strategies and schedules to kind of keep us grounded, then it can really send us spiraling when it comes to things like anxiety, depression, stress, stress-related illnesses. And so I certainly am experiencing in my practice as a psychologist a lot of that stress, and hearing from people that are really struggling to navigate what this new normal looks like. I think that one of the things that we all know is making this more challenging is the fact that we don't necessarily have an end date. I know I've heard from a lot of people, and I feel this way myself, that if we had in mind a point at which things would go back to quote unquote normal, that might feel like we could focus on that. So one of the things that I think we have to do when we don't have the certainty that we desire is kind of focus on what we can control. And to some degree, that's our internal experience, as much as we can have an impact on that. So I thought I would give a few tips and strategies that I think can be helpful as we navigate this time. I I think one of the things that I'm hearing, so first thing that I'm hearing from people is that they're really struggling with their relationship to food right now. And so I wanted to say a couple words about that. We're stuck inside in a lot of cases. We've been hearing all the sort of warnings to get to the grocery store, stock up, and especially if you have a pre-existing difficult relationship with food, but even if you haven't before, a lot of the mindset around food scarcity or fearing that there's not going to be enough or that we have to stockpile what we have, I think it's important to know that kind of lists at a lot of disordered eating behaviors. And so there's a couple things that I would just kind of mention when it comes to navigating that relationship. The first thing is that despite the fact that many of us have had our routines totally thrown off, having a set routine around meal times, snack times, eating throughout the day can be really important right now, both for our mental and physical health. It can be easy just to get into a pattern of snacking and kind of grazing throughout the day, but actually sitting down, especially if you're living with other people, if a family, sitting down together, actually having set meals where you're enjoying that time together and then you're transitioning to another activity can be really helpful. Another thing that can be helpful is if you find yourself turning to snacks or food when you're feeling really overwhelmed and stressed, I would think about for a moment and try to take some time to step away and do some introspection on what it actually is that you're feeling. Talk to a friend, if there's family around, obviously spend some time journaling. This is a great time to start journaling if you haven't been doing it, as a way of just getting in touch with all the various emotions that you might be having. Movement is another great thing to be thinking about, both, of course, for our physical health, but also for our mental health. And I know a lot of people that, are used to going elsewhere, going to a gym, going to a class, things like that, as a way of kind of maintaining their mental health. And so I really encourage you to obviously get creative. There's a lot of cool things online right now. And really, it might be about kind of reshaping our relationship to movement for the moment. So remember that going on a walk around your block, even with shelter-in-place orders, we are permitted to do that, to get out and move our bodies. And that, of course, can have significant benefits for our mental wellness. Couple more things I would just mention are that if you can choose maybe 1 to 2 outlets or sources of information. Lisa's 3 o'clock update is a great one to turn on the notifications for, and that you can tune in at that time, get some solid evidence-based information without all the kind of sensationalism. That's a great way of maintaining the information that's flowing in. So just also hearing from a lot of people, they feel like they're on total information overload right now. That is to be expected. And if we can, both with the media sources that we're choosing to engage with, as well as with friends, I think one thing that's been helpful for a lot of people has been to make sure that you're telling friends and family that might be sending you text updates or, forwarding you articles, that what you need in terms of your capacity to take in some of that information. If you don't feel like more information is helpful right now, let them know that you want to be taken off that text chain. It's not something you can talk about right now, that you're really trying to work on managing your stress level. And I know several people who've done this, and they've found a real weight lifted when they could just let people know that they're not open for business when it comes to more COVID news. And one other thing I'll mention before we talk a little bit more, and certainly if there are questions, we'd love to hear them and talk about what's going on for you, is that I think we have to all collectively lower our expectations about what we can accomplish right now, how we're parenting, how we're navigating our relationships at the moment. This is like, there's no gold star for like pandemic navigation or doing this all well. Like everyone's saying, none of us have ever done this before, and we don't know how to function in this way. So we're all learning together. I don't know about you, but that's really helping me to know that, you know, it's one thing if I'm in a crisis alone. It's actually helping me to know that we're in this process together. And so lowering our expectations when it comes to what we can do, what we can give, thinking about what we might have to give up in order to free up some resources for ourselves to be able to function and cope more effectively. So I know for someone like me during a time like this, like I totally lean into action, action, action. What can I do? Where can I serve? What's needed? What can I do better? And that's not always the healthiest perspective in a situation like this, because it takes a lot of internal resources to do that. And then those aren't available for me to be able to, and maybe for some of you to just take care of our emotional needs. So those are some things I'm seeing. I think I didn't mention it specifically, but community is so important right now. I think I've seen lots of people doing virtual happy hours and connecting with friends online, which is awesome. And I think that there's such a need for that. We are in my practice doing some what we call circles, which are groups of people coming together around a particular challenge like binge eating or prenatal concerns and things like that, to be able to foster that community. And as much as you are able to find that community and talk with other people about what you're experiencing, we know actually from research that social isolation is really one of the most significant risk factors for health. And so we don't want to let social isolation be our next health crisis. We have to be fostering that now, even if it's hard and feels a little bit weird and uncomfortable.
So actually, we're still having technology issues. I can actually read you some of the questions that have come through, because we're not seeing them scroll.
Oh, great.
This from someone: any reassuring messages for pregnant moms that are approaching due dates and concerned about the hospital?
Yeah, and Lisa, I'd love for you to weigh in too, but a couple of things that I would say. One, just like if you are going through this as a pregnant person, my heart is with you. I think that I know that it can be an experience that can make you feel so vulnerable to begin with, to be obviously caring for yourself and your baby. And so I know that people are dealing with changing birth plans, with different hospital procedures from what they might have been planning mentally and logistically. And so words of encouragement. I know that most hospitals, this may or may not be encouraging, but I know that most hospitals are still allowing at least one partner to accompany the birthing person. And so choose that person wisely, of course, but know that you will have support in your support person if you've chosen a team of providers that you really feel safe and comfortable with. Know that they are going to be doing their absolute best to provide you the comfort that you need. I know lots of friends and family who are labor and delivery nurses right now, and they're just kicking it into high gear. They know that pregnant people are really feeling worried and anxious right now, and they're there ready to be, they're there on the front lines and they're ready to be a support. If you're finding that your anxiety is really elevating, I would say that there are some great prenatal meditations and great apps, like specifically for people preparing for birth, that could be a really good resource. Doing something like that, one time a day for 10 minutes, just going through a prenatal meditation can be really helpful in just building the skills that, not just that you'll need now, but actually, as you go obviously through the birth of your child and beyond. Doesn't get much easier after birth, actually, and there's still going to be a lot of anxiety. So those tools that you can build now to kind of regulate your nervous system can be really useful in the long run.
So I would, those are great tips. I would add for pregnant women, this is actually, if you're close to delivering in the next couple of weeks now, this is social, distancing is really, really important. I mean, your network right now should be really small, as small as you can make it. And I know that's hard, but think about that, which is you don't want your spouse or your partner or whoever to be infected, because there's the incubation period, and then be sick when you have the baby and you get sick, right? So I think the smaller you can make your universe right now and the more social distancing that you can to prevent yourself and your partner from being infected is really, really important. And I would put my patient in the category of being an older person with health problems, where I'm lecturing people up and down, you should not be visiting your grandkids right now. Like, stay home, stay home, stay home. And I would say that for you too. And I know the hospitals are really doing everything they can to take extra precautions and certainly making sure the nurses are not ill and all of that. So hang in there. I know it's stressful. All right, the questions now are coming through, it looks like, actually. So let's go. I have to get allergy shots each week. I feel panicked every time I enter the office. Any advice other than wash your hands before and after? Any advice, actually?
Sure. Yeah. I mean, I think that grounding yourself before you go into the situation, like in the space where maybe you're still feeling some sense of safety, can be really helpful. So not waiting until you've entered the office and you're feeling that panic kind of wash over you, but trying to implement some skills even from when you wake up that day and maybe are noticing that your anxiety is increasing. So when we think about the physical response to anxiety, we're thinking about our nervous system really escalating and needing to downregulate ourselves so that we can kind of access a more rational, reasonable thought process. So physical practices are really helpful because they can directly impact on that. They can directly support that down regulation and bringing us, our nervous system, into a calmer space. So movement is really helpful for that, for down regulating, breathing practices, meditation, changing your body temperature. If you are in a moment of really high panic, maybe you're fearing that a panic attack might come on, changing your body temperature really quickly is actually a really helpful way to interrupt that. So that can look like holding ice in your hands, for example, or putting a cold rag on your face just to have that quick change in body temperature. So think about some of those like physically grounding activities, taking a short walk. Like I said, doing some of that like more rhythmic breathing where you're really tuning into slowing down your breath in and out can be really helpful. Do a session of yoga. There's so many resources online right now for like simple yoga practices that you can implement. And I would also say, just let your provider know how you're feeling too. They might be able to offer some words of reassurance. I know that providers are doing everything in their power to just make sure their environments are as safe as possible for patients that are needing to be seen. So it might be helpful for you to even hear about some of the things that they've put in place. Lisa, would you have anything to add to that?
No, I think you should talk to your provider and get a sense of what they're doing. I mean, just some reassurance. I mean, there is nothing that's 100% perfect right now, right? So we know that you can be exposed even going to the grocery store, which we all have to do occasionally now. But again, hang in there. And I know you don't want to hear it, but wash your hands before and after.
Yeah.
Everyone's struggling with wanting to eat bad food like frozen pizza and Diet Coke, hard to stay focused, like the journaling idea.
Yeah.
Right. So I'm struggling with those same things too. I have said it's funny, the Diet Coke thing, right? In our generation, right? I gave up Diet Coke for a long period of time. And then when I had chemotherapy, it was the first thing I wanted. Then I gave it up again. And after my spine fusion, I woke up from anesthesia and it was the first thing I wanted. And I have just bought my first case of Diet Coke again in the last right now because I wanted Diet Coke and pizza too. So I can totally relate. That must be There must be something to that for those of us that have grown up on Diet Coke. Any advice on how to handle feelings of guilt that you are working from home, self-isolating when coworkers are reporting for duty? Yeah, that's nice.
Yeah.
You have any thoughts?
Yeah. Well, first I would wonder why they're reporting for duty unless they're an essential, a healthcare provider and some other kind of essential business. I'm assuming that if you are able to work from home, hopefully there might be an option for them too. I think that if they're not, it's based on, differences in your job responsibilities. I think there's so much guilt, I think, swimming around for a lot of people trying to navigate what it means to, have all these different responsibilities at home or what their situation compared to some of their neighbors look like. I would remind ourselves about what guilt really implies. I mean, we all experience guilty feelings, but guilt really implies that we have, it's an emotion that tries to signal to us that we've done something wrong. None of us have done anything wrong. And this
said Facebook logged me off. I don't know why. Anyway, so I think I answered that. I think there's a couple other questions here. Boy, what a technology. Ashley, why don't you talk about your prenatal Thrive group that you're starting?
Yeah.
Ashley may make that pregnant woman who asked the question be a great thing for her.
Yeah. So this week, actually, we are launching what we're calling a prenatal Thrive Circle. So a small group of women going through pregnancy, where we'll be sharing resources, education, support, connection. It's once a week for 4 weeks. We're starting this Wednesday evening. And so if you want some information about that, you can find it all on our website, which is GalliaCollaborative.com. And I'll post that in the comments in just a bit as well. And you'll see a section about circles. So like I was mentioning earlier, we do circles focused on lots of different struggles that people might be having or unique experiences, and each are led by kind of an expert in that area. So I'm really excited for this one because I know just how much anxiety and stress pregnant people are feeling right now.
And I would love to make a plug. Ashley and I have been talking a little bit about things that the community or people that are listening today might need. And so if you have suggestions for other Thrive groups or specific things that we might talk about, please submit them, because I think Ashley will come back and maybe we'll have less technical issues the next time. Maybe there's a Thrive circle that you would like to start. So a couple other questions. Heard about dogs. Can they carry the virus in their fur? Was thinking about dog daycare tomorrow because of the rain, but now I don't know. So this is not an infection of dogs. Dogs cannot transmit this to humans. Dogs don't get this. I have seen zero data about dog fur, so I really would be making it up if I told you one way or the other. My guess is that that's not a good place. And I'm not sure that there's any way that, I can think about that, right? So dog fur on your face or your mouth. I guess if you're kissing your dog, I have no way of knowing, but I would tell you, I think you can safely send your dog to doggy daycare. And I am going to send mine this week as well. Do you think there is a risk with encouraging the purchase of food prepared outside the home? Again, that came up a couple sessions ago. So certainly, food handlers are washing hands and being more careful now. If they touch meat prior to it being cooked, obviously that's not a problem. If they're putting it in packages, anything that I've seen now, everybody's wearing gloves. You assume, hopefully, that they are handling those gloves, not touching their face appropriately, and that they're being screened, that they're staying home if they have any symptoms at all or any low-grade fevers. When you have a delivery person who brings you food, again, it's hand washing after you take it out of the package. But again, I think we do the best we can, and I don't really think that that's a important source of transmission of the virus as long as you're washing hands. Have you heard anything about using antibodies from those that have already been infected? Yes, I've been reading about that. There is some really interesting data about that, but remember, this is way off from being a treatment yet. You know, using serum from other humans is, you know, more risky than developing a drug in terms of needing to be tested. And so this is a long way off, but there is really interesting research being done on this, and you know, that's coming like the vaccine and like other drugs. And I think that's all. Again, I would really say thank you to Ashley, but also if you have ideas of things that we can be helpful with, either other Thrive groups or having Ashley come back and talk about specific topics, please submit them to me and we will be sure to take a look at that and have another Facebook Live with her sometime soon. So thank you very much.
Thank you.
Technical issues again today. Bye.